What is the kidney transplant process for PKD patients? Imagine living with a condition where your kidneys grow large cysts that can cause pain, infections, and eventually lead to kidney failure. That's what happens with polycystic kidney disease, a genetic disorder affecting many people worldwide. When the kidneys can no longer do their job, a kidney transplant often becomes the best option to restore health and improve quality of life. The process starts with a detailed evaluation. Doctors will check your overall health, kidney function, and look for any other issues that might affect surgery. Since polycystic kidneys can become very large and cause symptoms, imaging tests like ultrasounds or MRIs are used to see how big they are and if removal might be needed. Sometimes, doctors also screen for related problems, such as brain aneurysms, because PKD can affect blood vessels in the brain. Next comes pre-transplant preparation. Because PKD kidneys can be huge and cause discomfort or other complications, some patients need their native kidneys removed before or during the transplant. This removal is called nephrectomy. Surgeons often use minimally invasive techniques, like robotic surgery, to reduce pain and recovery time. In some cases, the nephrectomy and transplant are done in one operation, which can be more convenient and reduce overall hospital stays. Waiting for a donor kidney is the next step. Patients can receive a kidney from a deceased donor or a living donor. Living donors, often family or friends, usually provide better outcomes and shorter waiting times. If waiting for a deceased donor, patients are placed on a waiting list managed by transplant centers. The timing depends on factors like blood type, tissue compatibility, and urgency. When a suitable kidney becomes available, the transplant surgery begins. The surgeon places the donor kidney into the lower abdomen, usually on the right or left side. Blood vessels from the donor kidney are connected to the recipient's iliac vessels, and the ureter, which carries urine from the kidney, is attached to the bladder. The native kidneys are typically left in place unless they were removed earlier due to symptoms. The operation is performed under general anesthesia and usually takes several hours. Afterward, patients stay in the hospital for a few days to monitor recovery. Post-surgery, the new kidney often starts working immediately, but sometimes patients need temporary dialysis until the kidney stabilizes. Doctors will closely watch for signs of rejection, infection, or other complications. To prevent rejection, patients take immunosuppressive medications, which help the body accept the new organ. Recovery times vary, but minimally invasive techniques have made the process smoother and faster for many. Long-term care involves regular follow-up with a transplant specialist. They will monitor kidney function, adjust medications as needed, and screen for potential issues like infections or vascular problems. Patients with PKD might also need ongoing checks for related conditions, such as cysts in the liver or blood vessel abnormalities. In summary, the kidney transplant process for PKD patients involves careful evaluation, possible removal of enlarged kidneys, waiting for a compatible donor, surgical placement of the new kidney, and ongoing medical management. Advances in surgical techniques, especially minimally invasive and robotic surgeries, have improved outcomes and recovery times. Kidney transplantation remains the most effective treatment for kidney failure caused by PKD, offering patients a chance for better health and a more active life. Always consult with a healthcare team experienced in transplant care to get personalized advice tailored to your specific situation.